Learn about spinal anesthesia in no time. So, what's the indication of spinal anesthesia? It's indicated for below umbilicus surgeries which are done within 2 to 3 hours of duration. What is the site for spinal anesthesia? It is basically the L3 to L5. How will you identify? With the help of Duffier's line. The needle that we introduce for spinal anesthesia is a dura separating needle, a thin bore dura separating needle. But as you are passing the needle from the skin, what are the layers that are pierced? Skin, subcutaneous tissue, supraspinous ligament, interspinous ligament, ligamentum flavum, which is the toughest ligament. On piercing of it, you will feel a snap. Okay. Next, dura, and the last layer to be pierced is arachnoid. After giving spinal anesthesia, what are the complications that you see? These complications are intraoperative complications and postoperative complications. So immediately after giving spinal anesthesia, as spinal is producing a sympathetic blockade of the lower extremities, all the blood from the upper side gets pulled into the lower part, leading to hypotension, which is the most common complication. Next, bradycardia, second common complication. Third, shivering. Next, there could be two complications related to the drug ascending upward in spinal anesthesia. One could be a high spinal anesthesia and other could be the total spinal anesthesia. These are intra. So now coming to the post-op complication, the most common post-op complication is urinary retention due to blockage of sacral fibers. Apart from that, patient might have headache, patient might have sixth cranial nerve palsy. Now discussing the contraindications, remember spinal is contraindicated if the patient is having a raised ICP. Why? Because if you give spinal anesthesia, there could be herniation of meninges. Spinal is contraindicated in shock-like conditions. Why? Because if you give spinal anesthesia in shock-like condition, hypotension can worsen. Spinal is contraindicated in bleeding disorders. Patient, if he is refusing, I don't want to go for spinal, it is contraindicated. And lastly, if patient is having any major cardiac issue, spinal anesthesia is contraindicated.